Traditional treatments, surgery, radiation, chemotherapy, have not a specific target in mind, but they target fundamental principles. So radiation is supposed to kill growing cells, and it zaps the DNA and basically fries the DNA of the cell, and then the cell dies. And chemotherapy is, many of the drugs are based on cells that grow fast, and so it kills fast-growing cells. So what we've hoped to be is much more precise, because these treatments have a lot of toxicity. And so if we can identify something wrong in the cancer cell only, and then we can target that. And so it's a little bit sort of the Achilles heel is one way to refer to it. So if you can find the weakness in the cancer cell and exploit that and drive hard, because the normal cell doesn't have the same weakness, then you can kill the cancer cell and not have the kind of side effects that traditional chemotherapy has had. So what does this mean? Well, first of all, we've learned that everyone's cancer is different. You know, if you have leukemia, we used to think that everybody whose leukemia looked the same under the microscope had pretty much the same things wrong inside, but we now know that it's different. And so if you want to find the right therapy for yourself, it's become more complicated, because we really need to know more about your own cancer than we did in the past, where we would just treat 100 people all the same. And so what that involves in part is genomics, so that the sample, the cancer cell, is sent off for a DNA analysis. We're born with a certain DNA, but that gets changed in the cancer cell. And so it's also important to compare the cancer cell with the normal cells in your body and find out what went awry. Then, based on what's awry in the cancer cell, we can focus in on specific drugs. And so this has been a revolution. You know, even in January of this year, President Obama got up in front of Congress and talked about the era of precision medicine, applying it to cancer and diabetes. And so what I would say to patients is, first of all, this is very new things. If your doctor is my age, okay, they didn't learn about any of this in medical school. And so to make sure that your doctor understands all of these latest things. You know, one of the things to tell the patients should ask their doctors when they're given a diagnosis is, what else could this be? And how sure are you that this is my diagnosis? And then once you're sure about the diagnosis, is what is there specific for my cancer that you think may be useful for me? And then, you know, we always advise people to get a second opinion. Oftentimes it's a little like a house. So it's good to have the planning so that you, before you start putting the second floor in, you've got the first floor. And so you should make sure before you start the treatment that things are well enough known so that the path forward, you know, the architectural plan for your treatment is in place. Sometimes you have to improvise, but before you get started, you should know. There are so many new drugs out now, and they're all effective, and figuring out what to combine with what. So it's really good to have an understanding at the beginning. What is the plan for my cancer? And then, of course, people want to know, is my cancer curable, not curable, how long I can live, all those sort of questions, and make sure patients get the information they need.